Leader of Third Party.
Thank you, Honourable Speaker. For months, we've been asking this government about data and asking them to be more transparent with data as a way to ensure that the public understands the reasons behind health orders and recommendations and can also understand what is informing government decision-making. Today, the Toronto Star headline captures this issue rather starkly, quote, as Whistler launches vaccination push, experts say BC has a COVID-19 data problem. The article points out that BC, quote, has generally stood out as a jurisdiction that is particularly poor at data transparency. In Ontario, data collection is informing vaccine rollout in a more transparent way with clear communication from government about what is informing their decisions. As Jean-Paul Soucy of COVID-19 Canada Open Data Working Group points out, quote, far from promoting stigma for these neighbourhoods, what it's done is actually pointed out deficiencies and inequalities. It drives the conversation around how policy can change to ameliorate these existing inequalities. We're in the third wave, Honourable Speaker, with variants of concern spreading throughout the province, and decisions about vaccine rollout are shifting, as has happened with Whistler. I have no doubt that data is informing the decisions here, but for the most part, British Columbians are left to connect the dots themselves, and questions are being asked about other regions and neighbourhoods where caseloads are high and decisions aren't shifting. My question through you is to the Minister of Health. Will he commit to improving data transparency moving forward as a way to rebuild public trust? And can he provide specific examples of how he will improve data transparency?
Minister of Health.
Thank you very much, Honourable Speaker. Thank you to the member for her question. The member will know, she refers to variants of concern, that we have done more genomic testing in BC than any other jurisdiction in North America. The reason is because clearly variants of concern are driving and helping to drive the current third wave of the COVID-19 pandemic. Last Thursday, Dr. Henry briefed British Columbians, the media, British Columbians, everyone at length on this question. There will be a further briefing this Thursday with more detailed information about variants of concern, about where we stand in the pandemic. British Columbia was first to give the public access to its modeling back in March of 2020, and we are going to continue to inform the public about what are the elements that should inform what they do and what government will do and what vaccination plans will do to deal with this third wave of the COVID-19 pandemic.
Leader of Third Party and Supplemental.
Thank you, Honourable Speaker. I expect part of the reason why BC is doing more genomic testing of variants of concern is because we have more variants of concern than almost anywhere else. But let's consider, Honourable Speaker, how BC has handled variants of concerns. Indeed, it is not. Unlike other provinces, there was initially a significant lag in reporting on variants of concern as the faster PCR results were not released, meaning that the variant data was only released after genomic testing. There has been a shift to this. Last week, the provincial health officer announced that, quote, we will no longer routinely genome sequence for confirmation. We'll just assume that those screen positives will be the variants. There is confusion around this, Honourable Speaker, and so my question through you again is to the Minister of Health. Can the Minister please explain exactly what the process is and will be in BC for testing variants, whether BC will be screening all positives for variants, and how will this data be shared with the public?
Minister of Health.
Well, Honourable Speaker, with respect to the latter, there was a detailed briefing last Thursday. There will be a detailed briefing this Thursday, led by the extraordinary epidemiological team at the BC Centre for Disease Control and our extraordinary provincial health officer, Dr. Bonnie Henry. She'll take the member and all British Columbians through the most up-to-date information about the COVID-19 pandemic, as she has done from the beginning of the pandemic. The member is quite wrong with respect to genomic testing in BC. It may make a good line in question period, but that's not the case. It reflects the commitment of the BC CDC to do everything they can to respond to this pandemic, to provide the information for policymakers, yes, provide the information for health practitioners, yes, and to provide information to the public. And that will continue to happen, including last week, including up to Thursday, including yesterday, and including this Thursday, when the presentation on the new modeling, including detailed information on variants of concern, will be provided.